Hey, good afternoon. Today we're going to be talking a little bit about Staphylococcus aureus. And here's staph in a few pictures. Here it is in a gram stain. It is a gram-positive cocci. You can see that it forms these grape-like clusters. Here it is on a sheep agar, blood agar, or sheep's blood agar. And you can see the beta hemolysis here. And then here it is on a mannitol salt agar. And you can see that as it ferments that mannitol sugar, it turns bright yellow. Some key characteristics. It is a gram-positive cocci that form in grape-like clusters. And the key requirement for it to be part of the Staphylococcaceae family is the 16's rDNA sequence. It is an opportunistic pathogen, meaning that it can occur normally in our normal microflora, but as it finds an opportunity, such as broken skin, it will take that opportunity and find its way in and become pathogenic. It is halotolerant, meaning it can survive high salt environments. And a good example of that is our sweaty skin that is salty, and it can survive that environment better than most other organisms. It is a facultative anaerobe, and it grows best at body temperature. It can grow anywhere between 18 and 40 degrees Celsius, but 37 degrees, which is body temperature, is optimal for its growth. Who is the likely host? Well, it usually occurs in humans. This is the most common, but it sometimes can occur in birds and mammals. An example of a mammal is like a dairy cow. They can get mastitis from Staphylococcus aureus, and that can be detrimental to the dairy industry. But it's usually occurs in humans. It is part of our normal microflora. About 20 to 30% of the population is colonized with S. aureus, and it's usually in the anterior nasal passages or the nares. And it's more common in close quarters, places like military barracks, college dorms, sports teams, places where you're sharing close spaces or sometimes even personal items. Diseases caused by S. aureus can be skin and soft tissue infections like impetigo, cellulitis, folliculitis. And these infections, start out as a bump or something that looks like a spider bite, a pimple, or a boil. And they can be swollen and warm and even sometimes painful to the touch. These aren't invasive infections, and they can be treated usually with cream or ointment. If it is a little more progressed, antibiotics may be necessary. A little more serious infection of the skin and soft tissue would be something like scalded skin syndrome. This is where the organism gives off a toxin that causes the infection. It's not the organism itself, but the toxin. And it can cause the skin it looks like a really bad sunburn or like you've been burned. That's the name, scalded skin, and your skin starts to slough off. And it usually happens in kids under the age of 5. But that is a little more serious infection, or toxic shock syndrome, which is also from toxin from S. aureus. Another infection or disease caused by S. aureus is food poisoning. This happens when you ingest food or drink that's contaminated with a toxin. There's the example of the rotisserie chicken. You bring it home from the store, it's piping hot, you debone it, but maybe while you didn't wash your hands and you have staph on your hands. And you debone it, you put it in the container, you let it maybe come to room temperature or cool off before you put it in the refrigerator. Maybe you forgot about it for a few hours. And you put it in, and then you go to eat it, and you warm it up. but the toxin is heat resistant. So you warming it up is not going to kill that toxin. So then you eat your rotisserie chicken and then you end up in the bathroom. It has a pretty rapid onset, but fortunately, it also has a rapid resolution. And those symptoms are abdominal cramps, nausea, vomiting, diarrhea, and dehydration from loss of all those fluids. So if that does happen, you need to be sure to drink lots of fluids to replace those that you've lost. There's also staphylococcal bacteremia, and this is very serious. There's an 80% mortality rate if it's left untreated. This is where the infection has gotten into your blood and caused an infection in the blood. And symptoms of this are low blood pressure, fever, and chills. And you need to be sure to get treatment as quick as possible. And this treatment is usually IV antibiotics. Here's a list of antibiotics and their and MRSA susceptibility to those antibiotics. So something like vancomycin would be a great option, although there are some vancomycin resistant strains of Staph aureus, but fortunately we do have some other options here. Control and prevention. The first thing would be good hygiene. Washing your hands before you debone that rotisserie chicken. That seems really simple, but a great prevention. Don't share personal items, things like towels and razors. Get prompt treatment of an infection. If avoid contact with wounds or bandages of those infected. So if you're changing, helping someone with a dressing or a bandage that has a staph infection, you need to be sure to wear gloves or wash your hands so that you don't get an infection yourself. And proper food handling, getting food in the refrigerator within 2 hours, or if it's above 90 degrees outside, get it in within an hour. You don't want to end up in the bathroom sick. Okay, who's at risk? These are some health status factors that increase your risk of infection. So people who are receiving dialysis, cancer patients, people with an HIV infection, those who've maybe recently received an organ transplant, and those who use IV drugs. Those all increase your risk of infection. These are also risk factors, but non-health status factors. So things like household contact with someone who has an infection, having an abrasion or wound yourself, and that leaving that's an open opportunity for this opportunistic pathogen to get in and cause infection. A crowded living environment could be a risk factor, as well as towel sharing. Here is the secular pattern of MRSA in the United States. We see hospital onset, community associated, and healthcare associated community onset. And you can see that it is a downward trend, which is great news. Here is MRSA in the United States, and you can see it's broken up into different regions. And do remember to take into account, these over here on like the east, population density is also a contributing factor to number of cases. And that is Staphylococcus aureus. I hope you've learned something today. If you have any questions, please feel free to ask me. Otherwise, have a fantastic day.